to get into my section called Myths versus Facts. It's something that we do every week on To Your Health with Dr. G. And what I do with this section is I just kind of say a statement, and my panelist says either myth or fact, gives us a kind of a brief summary of why it's a myth or a fact. We're going to kind of keep this rapid fire, but these are kind of common things. I always try to maybe stump my panelists every week because they're just so darn smart. But this is great information for you out there as well too. So if you had this kind of thought, you're like, okay, well, we're going to try to get the answers on this one. So here we go, myths versus facts, securing our health data here on To Your Health with Dr. G. Here we go. Dr. Zeitler, first question here. I like this one. Myth or fact? A doctor can send medical records to another doctor without your explicit consent.
That is a fact. As Ahmed mentioned before, again, it's sharing healthcare data to continue your care. So yes, it's
excellent.
It is true.
All right, Ahmed, here we go. Here's your statement. Myth or fact? Don't use outdated electronic devices. That's kind of a half statement.
I would say generally a fact. I'm a lawyer. I can't get pure. I have to disclaim and hedge and all that.
Yeah.
I mean, I think it's definitely a fact. I mean, that's simply what you see. A lot of old equipment isn't supported anymore, and so they're not protecting it as well as they used to, and that's how people hack. That's the avenue they get.
Excellent, and we got to talk about safely destroying old technology, old computers and things like that, because your information may still be there. Here we go, Dr. Zeitler, myth versus fact. I like this one. All right, we kind of sort of maybe answered this one, but here we go. Myth or fact? It's okay to share the medical policy numbers on your health insurance card at health fairs or over the phone with anyone.
No way.
So I think that's a double myth we'll call out there. Please explain.
Well, basically, again, you're giving somebody that you don't know what they're going to do with this information, vital data that they can then access, duplicate your entire life, take all of your information. If they've got, an insurance number or a social security number, they can create a new you that's not you, and then destroy your medical history, all your financial history, because they're stealing your identity. It's basically an open door to.
There it is. Excellent. Here we go. Next one here for Ahmed. Here we go. Hipaa prohibits email correspondence between doctors and patients. Myth or fact?
That's actually a myth. You could do it. I wouldn't recommend it because email, unless it's not encrypted, could be hacked. But they can. And a patient can, again, it's their information. I would not suggest it though.
Okay.
So I have a question to follow up on that, because I had been reading that if you type secure with a colon, that'll help in the subject line.
That's special to our system.
Okay.
And we
So
have a
only
special
certain
thing
systems.
if you use
Okay.
certain thing or do it a certain way,
Okay.
it'll actually will be encrypted.
Okay.
And that's why you can do it.
So, but it's not for the general public.
No,
So
for the
typing
general
secure
public. Well,
colon
if you
won't.
send it out externally, I think it does do something. It does
Okay.
make it still secure, but.
All right. Excellent.
Yeah.
I think I might jump in on this one. Let me participate a little bit in myths versus facts. I was going to ask you guys the questions, but here we go. I'm going to do this one. When it comes to personal health data, use strong passwords and change them frequently. I'd say fact. Don't use the same password across. Now, I'm a physician, but I'm just saying, generally speaking, don't use the same password across every single platform, because it's something that you easily remember. You got to keep like
Have you guys
variety's
been-
the spice of life.
Have you guys been noticing lately, like my computer, I'm a big Apple guy. Every time you put in a password, it wants to store the
Yes,
password.
I don't
It
like
does.
that.
I never
I don't
do
like
it,
Don't
but like,
store, yeah.
why? Why would you do
It's
that?
frightening.
I know it's easier on you, but
True.
I don't want anybody else to know my password.
I
That's
don't want
the
anybody
point
to
of
know
it.
anything. Yeah,
Right.
I totally
Right.
get you. True. All right, here we go. Next one for Dr. Zeitler. Here we go. Myth or fact? Be very thoughtful and careful about what details you publicly share about your life.
Absolutely. Actually, I was watching a news show a year or two ago, and it was saying if you're logging into what you think is that hotel Wi-Fi, but it's not exactly that, there may be somebody that's hacking your data. They took or not, I don't know how it works, but they're able to access your data as you're logging in. And one of my friend's daughters actually just had her account accessed because she just went in a public system and accessed her bank account.
There's a lot of risk.
Just best is don't access your health information or your bank information in a public domain.
Thank you very much. Here we go. I'm in myth or fact. Here we go. Patients can sue healthcare providers for violating HIPAA. Do we know about that?
I got a hedge here. I mean, it's partly fact. You could, but it's really not. what you want. The government actually provides penalties against covered entities who violate HIPAA, right? So the government will levy fines and do all that stuff for you. You can sue, but it's a little more complicated
right.
for this show. That's for sure.
All right, here we go. Here we go. We'll do a couple more of these. Here we go. For Dr. Zeitler, here we go. Statement. One should not blindly accept any terms of service or privacy agreement of healthcare devices and or apps without reading them carefully.
True fact. However, as we all know, do you really read all of the
We all
terms of
unfortunately do
services?
it, even
Yes.
lawyers.
Yes.
It's just, it's hard. They make them small print and very long for a reason.
Yes.
I'll just say that.
Oh, we read, and you guys
Yeah.
have read, and I was wondering, like, as you're reading that thing as a lawyer, do you see the legalese kind of written down in there? Because it's very, it's obviously it's not written at the level of the average
Yeah.
consumer. And that can be very difficult. All right, I'm gonna do this one. Let's try this one. I'm gonna participate again. Why not? I got one here. I like this one. HIPAA privacy rule applies only to electronic records. I think with anything that has your information. Oh wait, I should say myth or fact. I should know the rules of my own show, shouldn't I? I'm gonna say, and we have a lawyer here to back me up. So I'm gonna say it doesn't apply. I'm gonna say myth. That I think it applies to a lot of things. Any kind of health information out there, and you're a custodian of it, aka your doctor, your dentist, your healthcare system, that information is there. And so whether that's on electronic records or paper records or whatever kind of record there is, if it's written on sand and we save that sand, that information is certainly needs to be respected.
You got it right. So it's everything.
Thank you.
Also, it's verbal.
Verbal, right.
So if you
Right.
were just, you can't go in a Whole Foods and start talking about someone's health record if you're a provider. That's a breach.
Excellent. Well, there you go. We did some great myth versus facts, guys. So.